Hello, Angela Westover here, MN 590 student with Purdue Global University. In this video, I will be presenting my evidence-based practice project on incorporating computer ergonomics education for nurse health and safety. Again, my name is Angela Westover. I'll try to make this introduction about me quick and explain why I embarked on this project. I currently practice as a bedside emergency room nurse, but I did serve in the Army as a medic for almost 10 years. During that time in service, physical fitness became a part of my life. Over the past couple years, I became even more passionate about fitness that it led me to become a certified personal trainer under the National Academy of Sports Medicine. Even with me being a nurse, the certification course was very enlightening. Not only was I learning about how to properly move my body and weights for fitness, but I also saw application of that into everyday movement. Last year, I had a change in workplaces as an ER nurse, and with this change, I went from using desktop computers to the use of WOWs, or workstations on wheels. After a few months, I started to note significant pain in my right upper body to include my neck, my shoulder, arm, and upper back. I reevaluated everything I was doing in the gym to make sure I wasn't lifting incorrectly, but I didn't see much going on there. Then one day at work, on a day where the pain was pretty significant, I noted the position of my computer mouse and keyboard. The height were at varying levels of the devices, and it put my body into a weird position during use. I made corrections, and within time, I was able to note the difference, and the pain began to resolve. Since then, I've been more cognizant, not only of my computer ergonomics, but also of that of my peers. I frequently see other nurses using their computer workstations in such a way that misaligns their body, whether they're sitting or standing. I aim to share my knowledge and experience, and that I've recognized this can be a problem that can be resolved on a bigger scale if it were more formally addressed. Now let's take a look at the purpose of incorporating computer ergonomics education for nurses. Ergonomics is concerned with the design of systems related to how individuals interact with its parts, such as the use of equipment, performance of job functions, and the overall workplace environment in order to optimize human performance and well-being. Ergonomics can be applied in many ways, including the use of computer technology. In recent years, healthcare technology, including regular computer use, is increasingly being incorporated into the nursing profession. As computer use becomes a common task, many computer-using nurses still do not realize that sitting at a computer is more physically demanding than it appears. Computer use has actually been linked to serious musculoskeletal disorders, which range from minor aches to serious debilitating injuries. The body positioning and motions in the use of computers can lead to the user being subjected to the cumulative trauma cycle and repetitive stress injuries such as carpal tunnel syndrome, back pain, trigger finger, bursitis, and many other complications. Healthcare occupations have been found to have some of the highest prevalence rates of work-related musculoskeletal disorders. In the U.S., WMSDs create an economic burden estimated between $45 and $54 billion annually. Ergonomic education can be useful to ease this burden, as many computer workstation ergonomic principles can be quickly and easily implemented into the nursing workplace practice without any significant time or cost. Unfortunately, evidence has demonstrated that there is a high rate of preventable musculoskeletal injuries among nurses. Several surveys have provided that nurses are aware of the many occupational hazards which exist in their workplace causing these musculoskeletal disorders, but despite the increasing demand of computer use for patient care, rarely do they consider the impact of computer use. It has also been found that not only do nurses generally have low levels of knowledge in workplace ergonomics, but overall, healthcare workplace ergonomics tends to be poor or has several areas for improvement. Many studies have found, or are finding, that nursing workstations were not originally designed with much consideration to ergonomics, and many nurses or nursing workstations still do not even have ergonomic equipment available. Again, ergonomics can actually be applied to various nursing tasks such as patient handling and transfers, lifting, moving, twisting motions, computer use and nursing workstation design, body positioning for sitting or standing, and incorporating ergonomic principles can contribute to the reduction of complications such as WMSDs. As nurses gain ergonomic knowledge and are empowered to take ownership of their workplace practice through applying improved technique, their job performance will be optimized and job satisfaction can rise. Overall, expanding ergonomic education to incorporate nursing computer use can positively impact their health and safety. So, as the title of this presentation suggests, the purpose of this project is to integrate computer workstation ergonomics for nurses in order to improve their health and safety. A literature review was performed to find the most current information regarding nursing workstation ergonomics. Initially, refining filters included peer-reviewed articles and publication dates from 2015 to 2020. Although all articles included in this review for the evidence-based practice project are peer-reviewed, there was limited findings between those publication dates. An article from 2003 and one from 2014 were found to be applicable. Other articles included were published in 2016, 18, and 19. The search included a combination of terms such as computer workstation ergonomics, nurse computer use, nursing workstation design, cumulative trauma, and repetitive stress injury. The articles utilized for this EBP project included pilot projects, a cross-sectional study, descriptive and analytical studies, an experimental study, and a literature review. In my review of the literature, it was found that studies are being done to determine the relationship between computer use and injuries or work-related musculoskeletal disorders, and the impact of ergonomic education on injuries or WMSDs. Different types of ergonomic interventions and educational programs are being piloted in various healthcare workplaces to determine their impact and resourcefulness. After reviewing the literature and then completing a gap analysis, gaps were identified in the population, initiatives, support, and resources, as well as education. Very few studies were concentrated on the population of nurses in the hospital setting and included other individuals such as non-clinical workers, office workers, lab technicians, and/or community outreach nurses. Some of the ergonomic initiatives were not focused specifically on computer workstation ergonomics. Occasionally, they focus on other nursing tasks such as patient transfers, or they focus on other ergonomic recommendations such as environmental controls. The availability of support and resources was a very common gap on much of the literature reviewed. This included having outdated or inadequate equipment or workstation design, lack of professional consultation, lack of managerial support, and the absence of related policies or procedures. The gap in education is probably the most significant to note. This included ergonomic education as being absent or lacking, having limited educational delivery methods and modalities, ineffective education that is not interactive or engaging enough for the learner, or educational efforts that do not actually provoke behavior change for the computer-using nurse. As mentioned on the previous slide, the pre- and post-test included a short survey with questions related to behavior change in the trans-theoretical model. The trans-theoretical model, TTM, is a theoretical framework that can be applied to support the process of making intentional behavior change. When change is unfamiliar or different from the individual's normal routine, it can be difficult to initiate or maintain. Typically, unless the person receives a really good reason for the behavior change, then they will not do it. Fitness professionals have found that TTM is a helpful model of change in physical activity as it begins when the problem or need for change is perceived by the individual, then it supports the individuals through different stages of readiness to change. Here you can see the stages of change listed. The developers of TTM convey that persons in the pre-action stages require assistance in reaching a decision for action, which may include providing a motivator such as knowledge regarding the benefits, or rewards or actions, or ways to limit complications if the action is not performed, or a stimulator such as a training program that exposes participants to positive outcomes from engaging in the action or risks of not engaging in the action. Growing research indicates that human behavior theory models such as TTM are effective when related to clinical ergonomics such as moving and handling, as they make the change process more holistic. Applying behavior theories to ergonomics not only helps to provide more information, but it can also serve as a guide for the interventions, which will make change successful. With TTM, barriers can be identified and targeted information can be shared. It has been found that when the educational ergonomics intervention was based on TTM, there was success in gradually facilitating significant progress from operating room nurses to move from contemplation to preparation stages to the action stages, where they adopted correct ergonomics. To recruit participants for my EBP project, I put a request out to my classmates by group text and made a post to my personal Facebook page. I requested that nurses of any specialty who utilize computers in their practice participate. The program design included a pre-test, 3-part training curriculum, and a post-test. Various methods and modalities were used. The pre- and post-tests were created in Word document and provided to participants in PDF format. The pre- and post-test had 2 parts. The first part included 20 questions, 9 of those being about biomechanics and 11 about ergonomics. And the second part was an 8-question survey on ergonomic familiarity and behavior change in relation to the TTM. Once participants returned the pretest, they were provided the training curriculum links. Course 1 of the Nursing Workstation Ergonomics program, Biomechanics, was made in PowerPoint, then turned into a YouTube video that was approximately 13 minutes and a few seconds in length. Course 2 was made the same, Computer Ergonomic Principles. Course 3, Applied Ergonomics, was an 18-point checklist that was created in a Word document, then provided to the participants in a PDF format via shared Google document drive. Once the checklist was returned, participants were then provided the post-test. Participants were able to return their completed course documents in whatever way was convenient for them. This included either writing or typing their responses, photographing or scanning the documents, and replying by Facebook Messenger, text, and/or email. Tools used to evaluate the participants' learning included a pre- and post-test, as well as a survey on familiarity and the train's theoretical model. Both the pre- and post-test consisted of 20 questions in formats such as multiple choice, true, false, matching, and short answer. Both of the surveys were on Likert scales, with familiarity rating from 1 to 3 and the train's theoretical model from 1 to 5. Although separation isn't clearly defined for the learners taking the test, the pre- and post-test both incorporated 9 questions on biomechanics and 11 questions on ergonomics. Both of the surveys consisted of 4 questions. I used the pre- and post-test to compare the scores and identify whether or not there was a score increase, no change, or a score decrease. For this project, there was 10 participants, 2 male and 8 female. There are nurses from different levels who practice within different areas of a hospital setting. The chart here shows the results of analyzing the students' scores from pre-test to post-test. For the overall total exam, 70% of students had an increase in their score. No students had the same score from pre-test to post-test, and 30% of the students had a decrease in their score. Limitations included having such a small population of participants, being unable to provide the pre- and post-test in an easy-to-use digital format, the lack of having capable technology to design a truly interactive training module, being unable to validate learning and skills in hands-on or in person, and having difficulty determining if those students who maybe didn't demonstrate a gain in knowledge by their pre- and post-test scores would be able to demonstrate a gain in knowledge by their behavior changes. To forecast a positive future for this project, revisions and educational factors should be considered. This project was individually created, essentially with limited time and resources. If it were to advance to a professional scale, revisions should include having professionally improved processes for project delivery, training, and data collection, as well as standardized methods for these actions. Utilization of a learning management system would be quite beneficial. An LMS would be impactful to make the education more interactive, engaging, and easier for the learner to use. The material can then also be expanded to be more in-depth so that it further enhances the learner's knowledge and experience in ergonomics. To further the impact of the education, it should become a mandatory requirement for all nurses that use computers in any aspect of their nursing practice. The future of nursing computer workstation ergonomics should also include the creation of relevant policies and procedures, having increased resources available, such as adjustable equipment and professionals to consult for guidance, like IT personnel, occupational therapists, physiologists, or maybe even personal trainers. Having long-term follow-up to determine knowledge retention, application of principles, and to identify and implement the best practices for design and delivery of the training program. In applying ergonomic education such as this EBP project to nursing clinical practice, the improved outcomes would include, but are not limited to, the nurses' increased knowledge and awareness about biomechanics and computer ergonomics, as well as an increase in work performance and job satisfaction from the decrease in related complications such as RSIs and WMSDs, as well as the financial burden they create. So thank you again for taking the time to learn more about this EBP project and how computer workstation ergonomics in nursing education has great potential to improve the health and safety of nurses.